study about the appendix. So this is appendix, vermiform appendix. We already studied the cecum and ileum, that is small intestine. So here we can do a junction between the small intestine and the large intestine. Okay. Then below that junction we can see a worm-like projection. This is known as vermiform appendix. Vermiform appendix. So it has a base which is fixed to the large intestine and a free apical part. Yes, the base is fixed and has a free tip. And the base is attached to this opens in the orifice opens in the large intestine through an orifice or opening that is known as vermiform orifice of the vermiform appendix. And this orifice is guarded by a valve that is known as valve of Gerlach. Valve of Gerlach. So here sometimes you can see a mucosa, fold of mucosa which guards the orifice or opening of the vermiform appendix. That is known as valve of Gerlach, and this is the basal part, and here comes the free end. So this free end depends upon the position of the free end. Where it is seen, we can divide the appendix into different types, depend upon the tip portion, where the tip portion is seen. So the length of this appendix varies from 2 cm up to 20 cm. Okay. It can vary in length from 2 cm to 20 cm. Usually it is an average of about 9 cm in length, and it has a fixed base and a tip portion, free tip portion. So depends upon the position of the tip. We can divide the appendix into different types. So we are using the positions according to the position of a clock, timings of the clock. So we are telling according to the timing of the clock, position. So here we can see. So usually the appendix can be seen, tip of the appendix usually can be seen in a 12 o'clock position, that is behind the cecum. Behind the back of the cecum we can see it is directed upward in a 12 o'clock position. So this is the most common position of the appendix, 12 o'clock position. So it is known as retrocolic position because it is seen behind the colon. Okay, a retrocolic position or 12 o'clock position. Okay. So this is the most common type of position of the appendix. 65% of the people we can see the appendix is in a retrocolic position, okay, or 12 o'clock position. This is 12 o'clock position. Okay. Then next is 11 o'clock position. This is the 11 o'clock position, and this is known as paracolic position. Paracolic. So we can see the appendix on the side of the large intestine or side of the cecum. Okay, this is 11 o'clock position or paracolic position. Yeah. And here we can see another position, that is 3 o'clock position. This one, 3 o'clock position. So this position is also known as splenic position because it is seen towards the spleen. Okay, this is pointing towards the spleen, and this not 3 o'clock, 2 o'clock position. Sorry. 2 o'clock position. So this 2 o'clock position can be of two types. So this is our ileum. So sometimes the tip can be passes in front of the ileum, and otherwise it will be passes behind the ileum. So if it is passes in front of the ileum, we'll call it as pre-ileal, and it is passing behind the ileum, it is known as post-ileal position. Okay. So both are 2 o'clock position or splenic position. Splenic position or 2 o'clock position. And among them, this pre-ileal type is the most dangerous type of the appendix, pre-ileal type. Then next is 3 o'clock position. 3 o'clock position is otherwise known as promontoric position. Promontoric because it points towards the sacral promontory. Okay, promontory of the sacrum. So it is known as promontory position or 3 o'clock position. Okay. Then next is 4 o'clock position. This point towards the pelvic cavity. Okay. So it is known as 4 o'clock position or pelvic position. Pelvic 4 o'clock. Okay. Then next is the mid-inguinal position or 6 o'clock position. So this one, sorry, oh yes, 6 o'clock position, this one, pointing downward towards the uh, inguinal point, inguinal region. Okay, so this is known as mid-inguinal position or 6 o'clock position. So these are the various positions of the appendix, tip of the appendix. So you can start from 11 o'clock, 12 o'clock, then 2 o'clock, 3 o'clock, 4 o'clock and 6 o'clock position. Okay. 6 o'clock position. So these are the different positions of the appendix. Okay. This when the lumen of the lumen of the appendix is very narrow and it will be obliterated or it will be closed at the mid-adult life. Okay. Then this one, you can see the opening of this appendix can be seen 2 centimeter below the opening of the ileocecal opening. So 2 centimeter below that opening we can see the opening of the appendix. Okay. And it will be very narrow and sometimes most probably it will be closed during the mid-adult life. Okay. It will become closed, obliterated at the mid-adult life. Okay. So that is the opening of the vermiform appendix. Then we can see there is a mesentery or peritoneal fold associated with the appendix. This is known as mesoappendix or it is known as appendicular mesentery. Mesoappendix. Okay. This is the mesoappendix or appendicular mesentery. Then blood supply of the appendix. Appendix is supplied by appendicular artery. See, this is the appendicular artery and venous drainage is by the appendicular vein. The nerve supply, sympathetic, is derived from the T9 and T10 segments. T9 and T10 segments, that is sympathetic supply. Then parasympathetic is from the vagus. Then lymphatic drainage, most of the lymphatics drains into the ileocolic lymph nodes. Ileocolic lymph nodes through the appendicular lymph nodes. First it drains into the appendicular lymph nodes, from there it drains into the ileocolic lymph nodes. Histology of the appendix. Here we can see this is the section of the appendix. Mucosa, the villi will be absent, and here we can see the crypts of Libercums can be seen. These depressions are known as crypts. So crypts can be seen here, and lymphoid follicles can be seen in this mucosa. And then comes the mucosa muscularis mucosa, contains muscular layer, that is inner circular and outer longitudinal layer, and outermost serosal layer can be seen. Then applied anatomy. So the inflammation of the appendix is known as appendicitis. So this is a side McBurney's point. Here we can see if we are drawing a line joining the anterior superior iliac spine to the umbilicus. So the line joining the anterior superior iliac spine and to the umbilicus, the junction between the medial 2/3, this is medial 2/3 and lateral 1/3. So junction between the medial 2/3 and lateral 1/3, this junction, this is known as McBurney's point. So this is the point of maximum tenderness. So that point becomes soft. If we feel in that point, it becomes soft. At that point, we can feel the softness in that point. That point is known as McBurney's point in case of appendicitis. If any patient is having appendicitis, if we feel this point, that is McBurney's point, this point we can feel it will be maximum soft or tender. So this point is very tender in case of appendicitis. And we can feel this appendix and this umbilical region is both are supplied by same nerve, that is sympathetic by the T9 and T10 segment. So this portion is also supplied by T10 segments. Okay, so because of the same nerve supply, the appendicitis, the case of appendicitis, pain can be first felt in the around the umbilicus. The case of appendicitis, okay, so that is known as Rufford pain. So pain of the appendicitis can be first felt at the around the umbilical region because of the same nerve supply of both region. And the removal of the appendix is the surgical removal of the appendix is known as appendicectomy. So that's about the appendix.